The guidelines were developed following an intense period of qualitative work in each of our practice areas. The design of this project is centred around collaboration, and we've been incredibly grateful to the leads from the 8 local authorities and the 7 health trusts across England and Wales who've partnered us in this project. Throughout the project, we've also benefited greatly from the input of 2 advisory groups, one comprising policy and practice leads from across England and Wales, and the other a group of 12 women with lived experience of the system. Their input has proved invaluable, and we give our sincere thanks to all those who gave their time. As much of the data was collected during the pandemic, we faced significant challenges, but the dedication of the practice partners resulted us in including over 300 stakeholders in the interviews and focus groups. This included midwives, social workers, foster carers, guardians, heads of legal services in local authorities, and most importantly, parents with lived experience of state intervention at birth. Following analysis, the findings were presented to our advisory groups, and 3 subsequent workshops were held with the project leads from each of our practice sites and national leads from relevant stakeholder organisations. These collaborative workshops allowed us to both test the findings and to gain better insights into the system challenges, but also the possible ways forward. Following the workshops, the team set about drafting the guidelines, and significant input was received from reviewers and from our local advisory groups. This resulted in the draft guidance being published in February 2022. Given budget and time restrictions, particularly given the delay caused by the pandemic, we were not able to complete a full feasibility study, but instead we worked with each of our areas to develop a local area action plan. In order to develop these plans, we held various dissemination events to share the findings across the local systems with relevant organisations, and then we held local area multi-agency workshops in which practitioners and managers discussed the guidelines, identified their own priorities and actions for change. In most cases, a local area steering group was then established, which met regularly throughout the stage of the study to allow for review of progress and discussion of next steps. With the support of Research in Practice, we also established a community of practice, which included all our research partner sites, plus an additional 9 local authorities who'd received monies from the Department for Education under the COVID recovery monies to allow them to also look at implementing the guidelines. These regular meetings were a brilliant opportunity for all the local areas to learn from each other and share their practice developments. The research and subsequent guidelines have led to significant practice change in some areas. In one area, Blackpool, the research has led to significant investment in a co-production process in which practice managers from midwifery and children's social care are working with parents with lived experience of the system to review current practice and co-design a new perinatal offer for parents who are at risk of separation at birth. You can find the film giving more detail about this co-production work on this resources page. Whilst the project has come to an end, we continue to disseminate the findings and hope through our work with our research partners and other organisations such as the Family Rights Group, Birth Companions and Research in Practice that we continue to support practice change to support parents and babies when the state intervenes at birth due to safeguarding concerns.